Welcome to Stroger Hospital's Training Module number 6, the 10-step process for cleaning the occupied patient room and patient restroom. At Stroger Hospital, we believe that thorough environmental cleaning and disinfection is crucial to the health and well-being of patients, guests, and staff. As such, it is vital to understand the importance of environmental cleaning and disinfection of the patient rooms. Our goal is to remove the contamination of microorganisms from surfaces and equipment where patients receive care, in order to minimize the risk of disease transmission and cross-contamination. While we perform this important work, our goal as environmental services employees of Stroger Hospital is also to be ambassadors of Stroger Hospital to the patients, guests, and staff who are present while our work is being performed. In this training module, you will learn the 10-step process for patient room cleaning as follows. Number 1, interaction with the patient and guests, starting with saying hello. Number 2, safely emptying waste containers and removing trash. Number 3, high and low dusting of the patient room. Number 4, disinfecting surfaces. 5, spot cleaning surfaces. 6, cleaning and disinfecting the patient restroom. 7, dust mopping the floor. 8, performing final inspection of the patient room. 9, damp mopping the floor. 10, interacting with the patient before saying goodbye.
Before any cleaning work begins, make a determination of the correct PPE you must wear prior to entering the patient room. You will make this determination by reviewing the PPE precaution sign posted outside of the patient room. There are 3 types of precaution signs: droplet precautions, airborne precautions, and contact precautions. Each type of precaution specifies the type of personal protective equipment you must wear. Follow the PPE requirements and instructions exactly and completely. You may find 1, 2, or 3 of the precaution signs posted. If no precaution sign is displayed, then assume that you must wear the standard PPE of a Stroger uniform and vinyl gloves for your hands.
Before entering the patient room, remember the acronym AIDET plus P, which stands for A. Acknowledge the patient. I. Introduce yourself. D. Duration. Say approximately how long you'll be working in the patient's room. E. Explanation. What will you be doing? T. Thank you. Express a sincere thank you to patients and guests. And P. Promise to take care of or report any concerns the patients or guests might have. Also, be sure that you have washed your hands and put on a clean, fresh pair of gloves. Before entering a patient's room, knock on the door and introduce yourself, walking through the script that we have given you. Do not ask the patient, "How are you today?" Smile, however, and be positive. Always strive to make a good impression. Remember, you are an ambassador of the hospital. Start by positioning your cart properly, next to the patient room door opening, but do not block the doorway with your cart. Next, knock on the patient's room door, and be sure to do so even if the door is already wide open. This is a polite way of announcing that you are coming in, and also asking for permission to enter. Do not enter the room if the patient or one of the patient's guests asks you to wait. If you do not hear a response, knock again. If you still do not hear a response after the 3rd knock, enter slowly, being careful to listen and look for the presence of the patient or one of the patient's guests in the room. If no one is in the room, you may begin your work under the assumption that the room is occupied but the patient is not present. Perhaps they're walking the hallways or undergoing therapy. When placing the wet floor sign at the entrance of the room, be careful not to block or only minimally block the entrance to the room with the sign. The sign needs to be visible, but should not be right in the center pathway of the walking lane into the room. When you present yourself to the patient and guest, speak directly to them, make eye contact, and have a courteous demeanor and tone, and have a pleasant smile on your face. Remember that many of our patients may be struggling with difficult health issues, so it is not a good idea to ask, "How are you doing today?" Remember our Stroger EVS acronym for interaction with patients and guests. AIDET plus P. A. Acknowledge the patient and guest, speaking to them by name, using the formal Mr., Mrs., or Miss with the last name is respectful and polite. I. Introduce yourself by name, your first and last. D. Duration. Let the patient and guest know that you will be working in the room for about 15 to 20 minutes. E. Explain by letting them know that you are from the Environmental Services Department of Stroger Hospital and that you are there to clean and disinfect their room. T. Stands for thank you. Be sure to say please and thank you often, and especially be certain to say thank you when you are finishing your work and leaving the patient's room. P is for promise. Your promise to the patient is to take care of any requests they might have that you can take care of yourself, and that you are authorized to take care of yourself. Examples of such requests would be cleaning a surface or a spill, providing linens, moving a light piece of furniture, or turning on or off a light. Requests that you cannot take care of or that you are not authorized to take care of, you need to promise the patient that you will report the request to someone who can. Examples of requests you cannot and should not take care of yourself include giving medicine to a patient, giving food to a patient, moving a patient, or requests for repairs to the patient's room. For these types of requests, you can promise that you will report the request to your supervisor on behalf of the patient. Always remember, as a member of the Stroger Environmental Services team, you are an ambassador for the hospital. You have only one chance to make a great impression. Always use it to do your best. Let's talk about emptying the waste receptacles. Before you begin cleaning any patient-occupied room, it is important to remember to put on the appropriate level of PPE before entering. Next, inspect the area before pulling out the waste liner. This is to determine which portion of the room needs special attention, and it is also to gather any loose trash and place it in the waste basket. It is important that you keep biohazardous waste located in the red trash cans with red liners, separate from the regular waste. Never mix the two together.
If there is a large amount of waste in the receptacle, do not use your hands or feet to compress trash. This is to prevent injury from loose sharps that may have been improperly disposed of. When pulling trash, gather the trash liner by the upper edges and tie the liner closed. Lift the waste liner slowly out of the receptacle, keeping it away from your body. Never let the trash liner filled with trash bump up against any part of your body. While keeping the trash-filled liner away from your body, carry it to the designated container.
Before replacing the trash liner with a new clean liner, wipe the interior and exterior of the waste receptacle to disinfect and to remove any spills, drips, smudges, or fingerprints. Let's talk about high-low dusting. Always start dusting by first doing high-level dusting, then work your way down. However, do not perform high dusting above the occupied bed of a patient or over the heads of any patient's guests. High dusting in these spots can be left until the room is unoccupied and cleaned before a new patient assignment. When high dusting, take the microfiber duster and the extension tool and dust shoulder height or higher in the area. Dust the walls, ceilings, vents, ledges. furniture, fixture vents, and the wall around the vents. Dust windowsills, baseboards, and chair rails. Generally, you need to look for dust accumulation on any horizontal surfaces that can catch dust and make sure that you thoroughly clean it off. Sanitize all horizontal surfaces with an emphasis on what we call the high hand touch areas. High hand touch areas are surfaces that get a lot of hand traffic. If you look around the room, you can see what the high hand touch area surfaces are. Examples include doorknobs, light switches, bed rails, chair rails, patient food tray tables, telephones, TV remotes, nurse call buttons, cabinet pull or push knobs, and counters. Sanitation or disinfection cleaning is accomplished by applying neutral disinfectant cleaner to the surface. But remember, you must allow for the necessary 10-minute wet dwell time for the disinfectant to kill germs. Follow these steps for effective disinfection. Apply the neutral disinfectant cleaner. Allow it to sit for the necessary 10-minute wet dwell time. Wipe clean using the appropriate wiper. Use a blue wiper when cleaning in the patient room. Use an orange wiper when cleaning in the patient restroom. Leave the surface in a clean and streak-free condition. Vertical surfaces are areas such as walls, doors, door frames, and cabinets. Again, look for places on vertical surfaces where dirt, germs, splashes, or smudges can accumulate, and focus cleaning attention on these places. Examples include walls near or around waste cans often get splashes or spills. Door push plates or door frames are frequently touched by hands and can have smudges and fingerprints that need cleaning. Cabinet doors can also have fingerprints, smudges, and accumulated dirt. Spot clean vertical surfaces such as these using the neutral disinfectant cleaner and the appropriate wet dwell time to let the disinfectant kill microorganisms. Prepare to clean the patient restroom by placing the wet floor sign next to the restroom door. Next, high dust all horizontal surfaces in the restroom. For disinfection cleaning of surfaces and fixtures in the restroom, make sure you are using neutral disinfectant cleaner and orange microfiber wipers. Remember, orange wipers are for bathroom cleaning only. Blue wipers are for room cleaning only. On all bathroom surfaces, it is very important to apply the neutral disinfectant cleaner and allow the full 10-minute wet dwell time for the disinfectant to fully kill germs, viruses, and other microorganisms. Make sure to clean mirrors and dry with a paper towel to prevent streaks. Clean sinks and the surrounding area, such as the counter, underside of the sink bowl, and piping under the sink. Make sure to spot clean all splash marks on the wall that may be adjacent to the sink, the toilet, and the shower.
Clean the shower by starting at the top and working your way down and being sure to scour the shower basin floor. Next, start disinfecting the toilet by first applying bowl cleaner into the bowl of the toilet and allowing it to sit 10 minutes or more. Apply neutral disinfectant cleaner to the rim of the toilet, to both sides of the seat, and to all exterior surfaces of the toilet, again allowing for the proper wet dwell time. Wipe all surfaces of the toilet down and leave in a clean, streak-free condition. When cleaning the inside of the toilet bowl, use a Johnny mop to clean the inside and then replace the Johnny mop in its carrier container. Note: do not use the toilet bowl brush or Johnny mop on the outside of the toilet bowl or any other surface other than the inside of the toilet bowl. Remember to empty the bathroom waste cans taking all the same precautions used in emptying the patient room waste can. For example, do not compress the waste. Do not let the full waste bag you have pulled from the waste can bump up against any part of your body. Wipe the waste can clean and reline it with a new, clean liner.
Before you refill dispensers for soap and change the hand towels or toilet paper, stop. Remember, you have just cleaned the restroom.
Your gloved hands are contaminated with the microorganisms of the bathroom. Before you proceed to refill the dispensers and restock towels and linens, you must dispose your gloves, wash your hands, and put on new clean gloves. Once proper hand washing and regloving has been done, you can proceed. Restock paper towels with the fold properly facing downward so that the towels dispense as they are intended to. Refill the toilet paper dispenser. Make sure spare rolls are stocked in the room. Refill hand soap dispensers. Refill shower toiletries. Replenish bath towels, hand towels, washcloths, and other linens.
Begin damp mopping the floor. Patient room. Always make sure you dust mop before damp mopping. This excludes instances of obvious blood spill in the room, in which case it is appropriate to clean using the Stroger Hospital protocol for blood-borne pathogen cleaning as described in the Standard Operating Procedure and Training Module number 24. Be sure to move any furniture and dust mop underneath. Make sure you dust mop carefully in corners, along edges, and on the baseboard. Be careful not to lift or shake the dust mop during or after use, as this will cause excess dust and allergens to be lifted airborne into the indoor air environment of the patient room.
Before damp mopping, take a minute to do a final inspection of your work and make sure you have not missed anything. This is the time to inspect curtains and look for stains or portions of the curtain that might need repair. Be sure to check the sharp containers and arrange for its replacement if it is filled to capacity. Remember, sharp containers are sealed for your safety and for the safety of everyone at Stroger Hospital. Never attempt to open a sharp container. Double check all soap and hand sanitizer dispensers to make sure they are properly refilled. The same final check should be made to all paper product dispensers and all towels and linens. It is important that you check door hardware and metal kick plates to make sure that you have properly cleaned. If any items in the room need repair or any lights are burnt out, be sure to report this to your supervisor so a work order can be submitted to the Stroger Buildings and Grounds Department.
Prepare to damp mop the floor by placing a second wet floor sign inside of the room. You should have one wet floor sign outside of the room at the entrance and one in the room, with both being highly visible to minimize the risk of slips and falls. Begin damp mopping the floor, working around the room and using an S-stroke, paying special attention to corners and baseboards. Make sure to move any furniture and mop underneath. Make sure you mop behind doors. If you find any spills or stains on the floor, on the baseboards or in the corners, or near edges that you cannot remove, report these to your supervisor. Before reporting this, make sure you have made every effort to remove the spot, stain, or spill yourself.
Take one final look around the room and the restroom to make sure that you haven't left any of your tools or supplies behind. Let the patient and the patient's guests know that you are finished and thank them for allowing you into their room to do your work. Ask the patient and the guest if there is anything else that you can do for them. If it is something that you can do yourself and that you are authorized to do yourself, fulfill the request. If it is a request that must be fulfilled by one of Stroger's medical staff or someone else, let the patient know that you will report this to the appropriate person or department on their behalf. In all things, show the patient that you sincerely care for them while they are here with us at Stroger Hospital. Be sure to say goodbye as you leave the room.
Thank you for participating in Stroger Hospital's Training Module number 6, the 10-step process for cleaning the occupied patient room and patient restroom.